Oh, come on.
I have a question.
Okay.
If you could go back to school and get another credential at this point in your career, based on whatever alphabet soup you may have, I ask you, what credential would that be on your wish list?
Just go down the line.
Yeah.
I actually just went back and got my Lean Six Sigma Master Black Belt because I was passionate about process improvement. So not just doing things the right way, but actually finding the most efficient way to do things, whether it's financial efficiencies or operational efficiencies. That was something that was on my list, and that's something that I did take the time, to go back and do, and I think it was well worth it.
And one of our other grants has a Sigma Green Belt class.
Credential, did you say that was Sigma?
Six Sigma.
Lean Six Sigma.
I'm currently working on my CPHQ, which is Certified Professional Healthcare Quality, which Julie also has. And I think everything's changing with outcomes, so I think it's very appropriate with what I have right now.
Wow, that's a loaded question. I'm actually getting my bachelor's degree in April in something that has nothing to do with my career. But just passed, it's amazing how we keep going and getting certifications. I actually was able to get into the industry because of my certifications, all of my coding certifications, because I didn't have a degree. But I just in August got a AHCAE, CHCA certified coding auditor. And that certification actually just got approved through the Office of Inspector General for one of the top-notch. So it's all fill in the blank and stuff like that, but I got that one. I'm really not looking to get anymore. So I'm certified out right now. So, but I just got one in August, so that's a really good one. Auditing is a great field to be in.
I have started looking more towards retirement, to be honest. So I did start my master's program, but decided not to finish it because I am looking more towards focusing on getting to the retirement piece of it. But I would encourage anybody to look towards a master's because that I think is where our culture is today, to be perfectly honest. My husband is a private practitioner, is a psychologist. He has a master's degree that he really, if he were to not be looking more towards retirement, would need to get that PhD to be successful in today's world as a psychologist. I think that depending on how far you're reaching to the stars, that that education, you can never have too much education. I'm just looking at more of retirement and enjoying grandchildren and things like that. But one thing that I am very passionate about is data analysis and trending. One thing that I didn't mention earlier was I actually used to teach in the HIM program as an adjunct professor over at IRSC, although it's not IRSC anymore. So, is that what it is?
It's not no longer RCC.
Yes.
It's IRSC. You had it right.
So anyway, I enjoy teaching. I had a class that followed me every semester. They'd say, "What will you teach next?" I said, "What do you need next?" They're like, "We need, pharmacology." All right, I'll teach it. And then I'd have a full class. And we
You don't have those options.
So I took a class from beginning to end, and they all graduated, and they made me very proud. But I loved teaching, and I love mentoring students to become successful. But I also love to analyze data, trend pieces and parts that are broken, and figure out what is broken, what needs to fix, and then watch that data trend to success. So that was a long answer, but if I were to go back, I would continue my master's, and I would also probably focus in data analysis.
And for me, being the non-traditionalist that I am, I would definitely look at clinical application support. And I'm working on my CDI, and I just believe that
nursing has always been the core of who I am and what it is I do. And I come and look through everything with that clinical eye, even when it comes to coding. And my students will tell you that's exactly how I live my life. And so it's only natural for me to go into CDI, and it's only natural for me to take it to the clinical applications area.
Great. Any questions on specific credentials? Oh, come on. You were even assigned questions, so I.
Right?
I want to know, like, for RHI. What type of position can you have, like, with the RHI? Like, how?
In the VA specifically?
I don't care.
Oh, are you talking to me, Wanda? You talking to me?
What does the RHIT do for you in any of your?
Okay, the RHIT is a wonderful thing, okay, because that speaks volumes in your basic skill sets, as far as being anything from walking through the door with release of information to the process of transcription, to release of information, to coding, to denials, to billing, and in the whole revenue cycle. The RHIT right away says you have the requirements necessary to be able to function in all those aspects. In the VA system with an RHIT, it will get you very far. It will get you into management, and in some aspects may get you the opportunity to go into the upper management, including the chief of a service. Okay, although the tide may be changing to RHIA and above with a business degree or in some other clinical applications. But an RHIT will get you quite far in the VA system, yes.
And I worked with Linda Mazurski,
Yes.
actually, at VA to get the RHIT identified at West Palm
Yes.
as a shortage.
Yes.
As a credential that's in shortage in our region.
And it's still, within the VA system itself, is still one of the critical areas that remains a shortage. That's why there are some good incentives for people who are seeking the HIM route.
And just to piggyback on that, just when employers are, looking for someone, if you've gone into something that is too specialized, that's okay if that's where your passion is. But if you have something like the RHIT or the RHIA, then you are, the employers or the folks that are interviewing you know that that is a credential that has provided you education that is more well-rounded in the HIM field, whereas if you are obtaining a credential that's more like the CCS or something like that, then they know that you're just in the bubble of coding as opposed to the bubble of HIM management and such. And just to add to that, for the HCA model, because we have carved out analysis, coding, transcription, more operations away from the facilities, our HIM directors are not now required to be credentialed per se. We encourage it, but it's not required, and we do hire folks with HIM experience without that credential to be directors of departments now. And we have, I think, 2 openings for HIM directors right now, one in Tallahassee and one at Gulf Coast Medical Center out in the Panhandle. And so I think that those RH credentials are making the statement that your education has been more broad rather than focused.
I just want to say one thing, don't wait, take it as soon as you can.
Yes.
I have people that wait a year and a half and they're relearning everything over again. I have people that don't take it at all and they're just wasting their credential. Don't wait, take it as soon as you can.
We just actually had a student that came back. She graduated from her RHI. She's not here tonight, so I'm she actually graduated in the late 70s from an RRA program, and she came back to our coding program to upgrade her coding and sat for her RHIA while she was in the last semester of our program. So.
And never, ever, ever let your credential pass. Do not ever say, oh, I mean, I left healthcare for a while. I said, I'm burned out. I will never work in healthcare again. I am so glad I didn't let that credential fade away because I did decide to come back. So never, ever, I mean, my husband, he's a licensed in Michigan, he's licensed here. We have never let his Michigan license go away because you just never know what the future might bring. You've worked hard for those credentials, you keep them, no matter what. And that's, I encourage everybody to always keep a credential that you have, no matter what it is.
Can you ask them a question?
Sure, absolutely. They're not asking any.
So, how many people in the room like work in healthcare? Doesn't necessarily need to be HIM, but in healthcare today. And how many of the people with your hands raised work for like a hospital? Yeah, that's what I thought. That's kind of scary. It's a good and a bad thing, but there's so much opportunity that HIM can afford you. I heard a couple people talk about non-traditional roles. I'm from the South region, and we used to celebrate Health Information Management Week in October, the whole country nationally. In the South, we don't like to change too much, even though we're supposed to. So we still celebrate that. And we had all this. We had all. I know. I noticed. We're a week late. We had all the students put together a non-traditional career board, and we ended up with over 200 career boards with different professions. Every single one had, how can I use coding differently? Can I work for a technology company that helps write the encoders that you use in class? Hey, do you know that we just started ICD 10? Well, you can also take a look at what you learned in 10 and write what you change about it. And then you can work and start to write ICD 1011 through Stanford University. So you could work for an electronic health record company, a revenue cycle company. There's so much opportunity beyond, a traditional HIM role. There's a lot of non-traditional HIM roles. And if you're new to healthcare, if you're new to HIM, I would say that there's 2 sites. So if you're going through the AHIMA track, if there's any AHIMA credential that you'd like to pursue, you can go on AHIMA Engage and you can identify yourself as a mentor or a mentee. And you can also sign up for, AHIMA has an apprenticeship program. So my company is an employer with AHIMA, as I'm sure several of my peers are as well. And you can say, hey, I want to be an apprentice. And a company like mine, Precise, we're looking for, say, 100 apprentices.
They have to be a member though, right? Of AHIMA? They have to be a member.
They need to be a member of AHIMA, yeah.
Must be a member.
Yeah, to
Can
have,
they be a student member?
Yes.
Because that's
yeah,
usually more affordable, that membership level than.
Just got it in the mail, that apprenticeship, and that was gonna be one of my questions, if you could go through exactly that.
And there's flyers on the mentorship apprenticeship actually out on the cart that's right outside the door. So, and you're welcome to take any of that stuff that's on that cart.
if you're going through the AAPC track, their website is Project Extern, and it will do the same thing. Like in Florida, you'll say Amber's there, that's your contact person. You'll have name, email, contact, what positions we have open for apprentices. So if you can go to those 2 websites, they already have, if you're gonna follow one of these credentials, this is your gateway in to employers. We're very serious. I don't know how familiar you guys are with the market landscape, but today, HIM operates at a 20% workforce shortage. So you are in high demand. You are lucky and fortunate that you chose this career. Over the next 5 years, that's supposed to double. So in 5 years, we'll actually operate at a 40% workforce shortage. Which fortunate for folks entering the market, but want to make sure that you're happy and you find something that you like. An apprenticeship is a great way to try things out and see what you like and what you're good at.
So here's the site she was mentioning. It's the Engage, HIMA's Engage website, and right in the center they have the mentoring tab.
Can I just add to what she's talking about too? It's I didn't even really bring this up very much, but I think that in looking for careers, LinkedIn is a wonderful area, and I say that it's basically your resume on a business. That's kind of like being on Facebook personally, but when I started my business, most of my business in the first 3 years were people from the VA that I had worked with, and that eventually would dry up, and I went out on LinkedIn and talked about technical opportunities, was found by a company out in Washington, Seattle, Washington, and an international company. The gentleman that created Bing basically had started his own company for Microsoft, and we built a computer-assisted coding program for him within 6 months. And prepared for the HEMA conference when everybody was competing. It was a very last-minute thing on their part. But I want to say that those developers have to have people, because they're developers, they have to have people in our industry that understand the front to back. That's what we did in the VA process. All of those types of things are absolutely enormous. Even if you start out in coding, you get that experience. Same thing with clinical documentation improvement. They're clinical people that have been nurses and people there, you know, and I want to just kind of add one more thing is, based on what some of the panelists have said, home health, huge. They just do not have that help, and basically you all could be starting these new processes for them. Physician practices, ICD-10, major springboard for doctors. We do not code, for the most part, for medical records in a doctor's office. They are desperate for help because guess who your coder is? A doctor. Now they're scared to death because ICD-10 came out and they don't understand it. And because they don't understand it, now what's happened in hospitals all these years is starting to translate into physician practices, starting to translate in those areas that I'm going to tell you now are brand spanking new. We're out teaching it all the time.
And Public State has an online
so much opportunity.
ICD-10 CM for physicians.
Yeah, there's a lot of opportunity there. So I know we talk about hospital a lot. They're outpatient hospital too, diagnostic centers, ambulatory surgery centers. But you all are the foundation of those changes that are taking place that some of us who are a little more willing to talk about their age than I am, started a long time ago when we never imagined that we would be in the positions we're in, because most of us climbed that ladder. But it was because we came up with some ideas that nobody else was coming up with. When we went in the VA, Quadramed's product was in 9 VA facilities within 4 years because of process, not because we, you know, but those developers worked with us. We worked with 4 developers and process people, and those process people were coders, and those process people were nurses, and those process people were medical assistants. They're critical. So there's a lot of opportunity out there, and you all now are the ones to pave the way. ICD-10 had a mass exodus of coders for the most part, and now it's starting to come back. And the opportunities are unbelievable.
And actually DSS, the developing company, is one of our business partners.
Yeah, document
so that's our
storage systems.
informatics
Yes,
piece.
they're who we worked with. They're all Vista, which is the VA software programs, but those developers were smart. They hired process people that we designed the process from the ground floor for the VA, from front to back in the revenue cycle, and how to do work.
For a long time.
Yeah.
Question?
Yes, could you please, the DDS or whatever
DSS.
DSS?
It's a company.
Okay, and what's a DSS stand?
Document storage systems.
Okay.
And they developed actually interfaces for the VA. They're ex-VA employers, they're a software development company. But they have training opportunities for trainers that actually, which is what we started. Now I'm giving my
And they actually have new grad positions, especially if you have an IT background and you're adding HIT to that. They do, if you go to DSS's website, they have new grad positions. They typically look for a baccalaureate level, but that's more of their IT. So if you have a bachelor's degree in IT and then you added the associate's degree, if that's the route you took, then there's plenty of opportunity with DSS. They love our little informatics programs.
I have an RHIT, and I just took when I did my RHIT, though, I didn't get my CCA because they were like, wow, you know, I just went on to the RHIT. And then I just took a semester of ICD-10. And my question is, should I get a coding credential, or do I need one? Like, do I need a CCA in ICD-10, or should I can just go with the RHIT and try to find a job?
I'll take this. I get asked this question all the time. And for RHIT, okay, just to have the RHIT is a wonderful, great, heroic thing to possess. But it depends on where you want to spend your time and highlight your expertise. If you want to stay in coding and work in that clinical realm in coding, I would go for a coding credential. Because what you're saying is, yes, I have RHIT, even though I had that in my core curriculum or know of it in my core curriculum, I also have that credential that says, yes, I can stand with someone who's, let's say, just has one credential and spends their day from 9 to 5 or from 7 to whenever in their jammies coding from home. And if you're looking to be in that realm of RHIT or HIM, that would be something I would look for, yes.
And I can speak to the historical curriculum aspect of it, because so for older people, way back when